Good morning, good afternoon, and good evening, everyone. Welcome to the UN Network for Scaling Up Nutrition webinar, Multisectoral Mapping of Nutrition Actions. This is the first in a series of nutrition-focused webinars done in collaboration with the SecureNutrition Knowledge Platform, which is managed by the World Bank Group. My name is Aaron Buxbaum. I'm manager of the SecureNutrition Platform. This webinar is taking place on an application called WebEx, and I will describe a few features before the presenters begin. First, if you can hear me speaking now, you do not need to take any further action. To connect your audio, please use the audio menu near the very top of your screen. When you select audio connection, you'll see a box with 3 options appear. Most people select to connect using their computer, the bottom option. You may also use a phone to call in to the meeting. You will click the middle option and connect to the phone number indicated on your screen. Again, if you can hear me speaking now, you're all set. If you have trouble connecting on your computer, we suggest closing the WebEx application and simply joining again. Finally, if you continue to encounter difficulties, please note we are recording the entire session and we'll share the recording along with all the slides with you afterwards. In addition, please use the chat box to introduce yourself and also to ask questions. To open the chat box, look near the top of your screen for a small chat icon. When you click on it, you will see a new chat window open near the bottom of your screen at the right. If you select Everyone, you can send a question or say hello. Select Host or Laura Figazzolo, my colleague, if you are having technical problems, and we will do our best to assist you. This webinar will run for approximately 1 hour and 30 minutes. Please ask questions in the chat box throughout, and the presenters will answer these near the end of the session. It is now my pleasure to introduce Nicolas Bureau, who is the moderator for this session. Nicolas is currently the Deputy Global Coordinator of the UN Network for Sun and Reach Secretariat, which is hosted by World Food Program in Rome. He has previously worked with UNICEF, UNAIDS, and WFP, and he holds a PhD from the University of Minnesota in the United States. Nicolas, if you want to come off mute and take it for here, that would be great. Thank you.
Thank you, Aaron, and good morning, good afternoon, and good evening to everyone, and welcome to this webinar on multisectoral mapping of nutrition actions. Like Aaron said, this webinar is the first of a series of webinars that is organized by the UN Network for Sun in collaboration with SecureNutrition, which is managed by the World Bank Group. And I really want to take the opportunity to thank SecureNutrition very much for hosting this series and the great collaboration. So we are the UN Network for Sun. So just a bit of background for those who may not be so familiar with the UN Network for Sun. UN Network for Sun is one of the network of the Sun movement, which also includes civil society network, donor network, and private sector network. The UN Network for Sun includes at country level all the agencies, all the UN agencies that are active in nutrition, and also includes REACH facilitators for the countries where the REACH approach is being implemented. The UN network is present in all Sun countries and supports government with their national nutrition efforts and the governance and coordination for the scaling up of nutrition actions. I am myself talking from the UN Network for Sun and Reach Secretariat, which is hosted by the World Food Program in Rome. Today's webinar is about multi-stakeholder, multi-sectoral mapping of nutrition actions. It is a very important exercise. It helps governments in-country stakeholders better understand basically who does what and where in nutrition. The UN Network for Sun has to date supported governments and country stakeholders to conduct multi-sectoral mapping of nutrition actions in about 11 Sun countries and more recently in non-Sun countries. The UN Network is also working to support 8 additional countries with their mapping. And we also know that other mapping exercises have been conducted in various countries. Mapping of nutrition actions is also a key component of the Sun monitoring and evaluation framework, in that it provides information and data about, in particular, the first 2 steps in the Sun theory of change, in particular regarding multi-stakeholders coming together and actors changing their behaviors. So that will inform, basically, any mapping will inform those 2 steps. It is expected that all Sun countries will conduct mapping by the end of 2018, so about in a year and a half, as part of the SUN monitoring and evaluation framework. The process and tools that are presented to you today have been developed and refined over time by the REACH partnership under the UN Network for SUN. With that said, I will now give the floor to my colleague, Christina Reinhardt, who will run through the presentation. You have a bio in front of you, but basically Chris is part of our analytical team here at the UN Network for SUN REACH Secretariat in Rome, and she has supported mapping work in various countries. She has also recently led the development of the web-based version of the mapping tool, for which you will get a live demo during this webinar. Chris previously supported the REACH team in Tanzania on mapping and knowledge management within the Tanzania Food and Nutrition Center. She holds an MPA in development practice from Columbia University. Following Chris' presentation, we will open the floor for Q&A. We will have about 30 minutes for question and answers. And as Aaron reminded you, you will be able to log your questions in the chat box. Now I'm handing over to Chris for the presentation. Chris, over to you.
Thank you, Nicola, for the introduction, and thank you to all the participants for joining us today. The REACH mapping exercise is among many mapping exercises at both the global and country levels. For example, the United Nations Systems Standing Committee on Nutrition, UNSCN, recently mapped 167 global nutrition actors as presented in their discussion paper on global governance. Another example is the WHO Global Database on Implementation of Nutrition Actions, or otherwise known as GNAF. Other examples include OCHA's 3W and 4W exercises, MAFSAN from FAO, and the UN Network's UN Nutrition Inventory. These exercises provide a variety of valuable inputs for the understanding of the nutrition landscape at both the global and the country levels. Most stakeholder and action mapping exercises are often associated with who does what where, but not the assessment of geographic and population coverage of agreed actions. Quantitative analysis around geographic and population coverage of multisectoral actions in order to support scale-up, planning, and monitoring is a key differentiator of the REACH mapping tool. While this mapping tool was developed by REACH with support of the Boston Consulting Group, the tool is called the Scaling Up Nutrition Planning and Monitoring Tool, or SUN-PMP, since the findings help to frame planning and scale-up discussions and go beyond a traditional mapping exercise. The stakeholder and nutrition action mapping is relevant to a wide variety of stakeholders working in nutrition, including government ministries, subnational government administrations, NGOs, UN agencies, and donors. For governments, the mapping helps the central level government and ministries understand who they are working with in the field and what gaps in coverage are, so they can be better positioned to coordinate NGOs and donors working in nutrition. For subnational government administrations, the mapping helps to understand who is working in their districts and be able to build on synergies between government and non-government actors. For UN agencies and NGOs, the mapping provides information on who else may be working on similar actions and where technical and logistical expertise may be needed for or may be present for particular actions. For donors, the mapping helps to highlight areas where funding may be missing or insufficient, or who potential partners are and where they are currently working. Mapping aims to support two different functions, which can ideally be combined. The stakeholder and action mapping can serve to collect baseline data on three types of information based on a country-defined list of core nutrition actions. First, the geographic coverage of actions can be assessed by collecting information on which stakeholders are working on each action and in which geographic areas. Second, the number of beneficiaries that each stakeholder reached can be divided by the total population of the target group to estimate the population coverage of the action. Finally, by comparing these results with the nutrition situation indicators, which are pulled from routine surveys already conducted, the stakeholders can identify which areas or populations would benefit from an increased scale-up of specific actions. Furthermore, the mapping can be used as a tool for implementation monitoring by collecting data on these actions continuously and comparing this data with the baseline results. The frequency of data collection may vary depending on whether the country is in an emergency or development setting. Through annual or biannual data collection, the coverage of actions and the country's understanding of how and where to scale up actions can be monitored over time. While most countries have only conducted baseline data collection, and this is recommended as a first step, the tool allows for comparing over time, and several countries are currently setting up to use the tool for ongoing implementation monitoring. The exercise helps to monitor the coverage of key actions in order to ensure that vulnerable populations receive the services they need. Conceptually, mapping aims to monitor the coverage of nutrition actions as part of a broader information landscape in the country. First, human and financial resources are input to support the activities of a project or program. Next, the output of these programs is the service delivery, which can take the form of various actions. For example, outputs may include food, supplements, or other supplies being procured and distributed, cash and vouchers dispersed, or capacity building provided directly to beneficiaries. Outcomes from these actions are the changes or effects that the beneficiaries experience as a result of the program's implementation. Finally, the intended impact is a long-term and broad improvement in the nutrition situation. The graphs below illustrate that as coverage of beneficiaries improve over time, the prevalence of malnutrition should be decreasing. If the mapping results show that this isn't happening, stakeholders can use the information collected to identify potential bottlenecks that might be impeding the inputs from reaching the desired outcome. In addition, the country can work with technical partners and UN agencies to conduct other, more specific analysis to find concrete solutions to improve their service delivery strategy. Before diving into the specific questions that the mapping exercise aims to answer, I want to quickly define what we mean by coverage and how we calculate the two types of coverage that you will hear me talk about today. The first type of coverage is geographic coverage. We define geographic coverage by the number of subnational zones reached by a particular action over the total subnational zones in a particular geographic unit. The specificity of the geographic coverage depends on the geographic level at which the data is collected. For example, let's say that an action is reported as being implemented in 4 regions. This is our numerator. And in our example country, there are 8 regions total. This is our denominator. Then the geographic coverage would be that the action is taking place in 4 out of 8 regions, or has 50% geographic coverage. Of course, this is a very simplified example, since in most cases we are collecting data at a lower geographic level. and will be able to calculate the geographic coverage of districts in a particular region or of districts in the whole country. On the right side is the other type of coverage, which is population coverage. This coverage adds up all beneficiaries reported for a particular action across the different stakeholders that reported in order to come up with a total number of beneficiaries reached for a particular action. This number of beneficiaries is then added to the total number, or is then divided, by the total number of potential beneficiaries, or the total target group population. The total target group population value is determined by the most recent census and accompanying population projections for the year being mapped. Mapping exercise uses the REACH mapping tool to answer a series of questions. The answers provide country stakeholders with a qualitative view of who is doing what where, a quantitative view of the percentage of sub-national areas covered and the percentage of targeted beneficiaries that are reached, a guide to help decision makers determine which actions should be scaled up based on action gaps and the nutrition situation in the country, and coverage trends over time and achievements of National Nutrition Plan targets. In the following slides, these questions will be answered or will be examined by illustrations from different countries. The first question, who are the stakeholders involved in nutrition and what are their roles? As you can see, the first two columns of this table contain a sample list of country-defined core nutrition actions and their categories. The column titles of the table are the stakeholder roles, which the mapping exercise uses to categorize stakeholders into groups and identify trends within and between roles. The column titled Responsible Ministries refers to the governmental entities that are responsible for a nutrition action. They are typically sector-specific ministries or multisectoral coordination units. In the next column, Catalyst refers to the stakeholders who provide technical support on the implementation of actions, for example, through technical assistance or capacity development. Often UN agencies and international NGOs are categorized as catalysts if they do not conduct the field-level implementation themselves. Next, field implementers refer to the actors who conduct the concrete implementation of an action, working directly with beneficiaries. Field implementers are often government staff, such as hospital workers, or staff from civil society organizations, such as local or international NGOs. Finally, donors refer to actors who provide funding for the action. We categorize the country stakeholders working in nutrition into these four categories as they allow us to understand who provides certain types of support, which roles include larger or smaller numbers of stakeholders, which actions have higher concentrations of stakeholders in a certain role, whether any stakeholders are performing multiple roles at once, and where efforts are being conducted by multiple stakeholders for the same action. This last component helps to ensure data quality as well in order to minimize potential double counting of actions. In the example, take a look at the second action listed in a yellow cell. Provide materials for training for small-scale horticulture. Following this row across, we can identify all the stakeholders who reported supporting this action in Tanzania during the mapping year. You will notice that 3 ministries were responsible for this action at the government level. A large number of organizations served as catalysts and field implementers, and 5 actors were donors. The next question is, which stakeholders are doing what and where? The mapping exercise allows countries to understand where each action is being implemented, and which stakeholders are working in each subnational geographic area. In this example from Burkina Faso, the mapping shows the geographic coverage of field implementers working on the promotion of optimal breastfeeding practices. Regions are shaded in blue, ranging from light blue, where 1 to 4 stakeholders are present, to dark blue, where 13 to 16 stakeholders are present. At a glance, this map shows that there are more stakeholders supporting the promotion of breastfeeding in the northern and eastern regions than in the center and south. In addition, this map lists out the stakeholders who reported reaching beneficiaries in each region. Note that this map is restricted to only field implementers. These field implementers might include government units whose locally based staff worked with beneficiaries, as well as field staff from non-governmental organizations. The mapping presents data from both of these sources and aggregates their data to produce a more comprehensive picture of the situation than is typically available. Next to each stakeholder name are Harvey balls, which represent the 4 levels of coverage: less than 25% of districts covered, 25 to 50, 50 to 75, and over 75%. The Harvey ball indicates the percent of provinces that were covered in the select region. Next 2 questions are, what percent of districts are covered per region, and what percent of target groups are covered by region? This example builds upon the information that was presented in the last slide by providing more detailed information about the promotion of optimal breastfeeding practices. The first column lists the regions that make up Burkina Faso, and the second column presents the coverage of provinces that receive the action within each region. In the first row, the fully filled Harvey ball indicates that this action was implemented in at least 75% of provinces of the region. However, in the last row, you can see a Harvey ball filled only a quarter of the way. This indicates that fewer than 25% of the provinces in the region receive the action of promoting breastfeeding. Finally, the third column in the table indicates the percentage of people in the defined target group who receive the action, as reported by the stakeholders who provided beneficiary data during data collection. In this example, the percent of pregnant and lactating women who were reported as having received promotion services is listed for each region. In the first row, we see that 21% of these women were reached. This table allows us to compare geographic coverage with population coverage by comparing the 2 columns, which provides hints as to the quality of targeting and delivery. In the first row, we see that the services were provided in all the provinces in the region, but only 21% of women were reached. This type of result will be discussed by the country stakeholders to contextualize the results and determine where improvements need to be made. The next question the tool aims to answer is, which regions are not adequately covered? This slide and the next provide examples of how our mapping results can be compared to indicators about the nutrition situation in the country in order to understand where actions may need to be scaled up. While the previous slides focused on one action at a time, this slide aggregates all of the country's core nutrition actions. The map on the left displays the prevalence of stunting throughout Niger, with darker orange shading in the regions where stunting is highest. The numbers in bubbles displays the absolute number of stunted children, which may be particularly high in regions with a dense population, even though their prevalence is relatively low. In this example, the prevalence of stunting is highest in Zinder, Maradi, and Diffa regions, while the absolute number of children affected is relatively lower in Diffa. The map on the right displays the number of core nutrition actions that are reaching more than 75% of their target populations. Darker blue regions have a higher number of actions reaching this percent of people. In this example, we see that out of 19 core nutrition actions, very few are reaching 75% or more of the target populations. Next question is, where are the action gaps in addressing key nutrition problems? In this example from Senegal, stunting prevalence in each region are plotted against the number of actions reaching at least 40% of their target populations to form a matrix that categorizes the regions by status. Along the y-axis, the percent of stunting is displayed. Along the x-axis, the number of actions reaching 40% of the population or more is displayed. The pink quadrant identifies regions that have high stunting and low action coverage. These regions may need the core nutrition actions to be further scaled up in order to reduce the stunting prevalence. Going clockwise, the orange quadrant identifies regions that have high stunting prevalence and where actions have high coverage of target populations. Regions in this quadrant would need to be investigated to understand why the stunting prevalence is high despite the high coverage of actions. In this example, none of the regions of Senegal have fallen into this category. In the green quadrant, regions have low stunting and high action coverage. This situation suggests that the high coverage of core nutrition actions is contributing to a low stunting prevalence, and the nutrition situation should be maintained. In the yellow quadrant, regions have low stunting prevalence and low action coverage. These regions need to be monitored in order to ensure that the stunting prevalence remains low and to scale up actions in the event that stunting prevalence increases. The next question is the target group coverage improving over time. This slide and the following analyze mapping data that has been collected at several points in time to understand trends and compare them to government targets. This example from Mozambique compares the current population coverage of actions with the trend in coverage over time by comparing 2014 mapping results with the baseline results from a mapping exercise done in 2011. Along the y-axis, the trend in coverage over time has been categorized as positive or negative based on whether the percent of target groups covered increased or decreased between 2011 and 2014. Along the x-axis, current coverage of these same actions is depicted. By plotting all of Mozambique's core nutrition actions along these axes, the matrix allows us to identify which actions need further attention and scale up, as you can see by the pink background, which actions need their negative trend to be reversed or their positive trend to be strengthened, as in the yellow background, and which actions need to be sustained, as you can see in the green background. The next and final question that the tool aims to answer is, are targets achieved as defined in the national plan? Mapping the coverage of various nutrition actions can help the country determine whether their nationally defined targets are being reached. In this template, the actions and target groups are listed in the first two columns, followed by Harvey balls and statistics summarizing the population coverage as collected during the baseline mapping exercise. The next section of the table identifies national annual targets by year. For each year, the mapping can determine what percentage of the target has been reached. These types of results can be useful to government stakeholders in monitoring their national nutrition plans and frameworks. If the National Nutrition Plan or other government framework does not include targets, certain national actions have global targets that have been defined and can be used for comparison. In this slide, we refer to action level targets that have been set at the country level. However, It is important to acknowledge that there are global and country-level targets for specific nutrition outcomes, such as the targets set by the World Health Assembly or indicators related to the Sustainable Development Goals. These are important for tracking country progress, since many actions selected by countries should and do aim to improve these outcome indicators. Now, the REACH mapping exercise has two different tools that have been developed. The first is the Excel-based version of the tool. This version relies on embedded macros to aggregate and perform coverage calculations reported in automated results tables. The results can be translated into PowerPoint templates in order to be presented and shared. The Excel version of the tool comes in two versions. The full version, where both geographic and population coverage data are collected, and a light version, where only geographic coverage data is collected. The other version of the tool is a web-based version built using DHIS2 technology. This is a new tool and developed in 2016. It was built on previous REACH experience in order to make the mapping exercise less labor-intensive and to make the tool more user-friendly. As a background, DHIS2 is an open-source system that is used as the technology for health information systems in many countries across Africa and Asia. The system is fully customizable to country data needs. For the REACH mapping exercise, we worked with a DHIS2 developer to build a standalone mapping module within the standard DHIS2 system that has customizable data entry and reporting tables related to the mapping exercise. These features, coupled with the robust data visualization modules that are already in place in DHIS2, create a tool with user-friendly data entry and a variety of customizable data visualization options. Before starting the mapping exercise, it is essential to gather input from key stakeholders in your country to tailor the exercise to the country's context and priorities. It is recommended to start with bilateral consultations with key players through small group discussions or one-on-ones. This might include government representatives involved in nutrition, such as the Sun Focal Point, members of the Multisectoral Stakeholder Platform for Nutrition, if one exists, and focal points for key ministries such as health, agriculture, and WASH. The purpose of these first meetings is to establish a preliminary view of the stakeholder landscape and of the actors who will be involved in setting up the exercise. In addition, it is important to ensure that there is a common understanding of the nutrition situation in the country and the causes associated with malnutrition, for example, through a nutrition situation analysis. The next step is to conduct a more formal workshop with key stakeholders across multiple sectors and types of organizations in order to gain consensus around the mapping scope and country specifics. Key steps include ensuring that the actors are aligned on the mapping objectives and its process, and identifying who the mapping team and technical lead will be at the country level. The nutrition landscape can be discussed and fine-tuned to ensure a common understanding of priorities. Next, the core nutrition actions to be mapped must be selected as a group, ensuring that the process is government-led and multisectoral in nature. This will be accompanied by the definition of key target groups that each action aims to reach and potential delivery mechanisms that will be mapped for each action. The mapping exercise can be done at multiple levels and degrees or complexity. So the stakeholders will also determine the best fit for the country and the timing of the mapping exercise. The mapping exercise is typically conducted following 5 steps: preparation, customization, data collection, analysis and visualization, and sharing results. Preparation is estimated to take 2 weeks, starting from when the mapping team and technical lead have been selected or recruited, and the country officially begins the mapping exercise. A multisectoral, multi-stakeholder workshop will take place and allow the country actors to agree on the selection of core nutrition actions, their target groups, and other mapping specifics. We at the UN Network REACH Secretariat can provide guidance to the technical lead on selecting the actions and defining the scope, including how to facilitate the process among multiple stakeholders. Next, the mapping team and its technical lead will customize the tool based on the country specifics that were selected. The UN Network REACH Secretariat can provide technical feedback on the customizing of the tool and confirm that it is ready to begin data collection. Depending on the tool that is chosen, Excel or web-based, the customization process may take a varying amount of time, but we estimate it to take about 2 weeks. The data collection can take 1 to 2 months, depending on the speed at which the actors provide data and the quality of their responses. Frequently, the mapping team will need to follow up with the organizations to ask questions, confirm which actions are being done in partnership with others, ensure that no beneficiaries are being counted twice, and other data triangulation and cleaning processes. During this phase, the UN Network REACH Secretariat can liaise with the technical lead on a continual basis to provide technical support with data collection and cleaning. Once data has been collected and cleaned, the analysis and creation of visualizations can begin. The mapping lead will use the tool to analyze the data, generating geographic and population coverage results. As results are available, they should be checked for data quality and shared with relevant focal points to ensure that the data has been interpreted correctly. Finally, the results can be used to create maps and tables to display mapping results and compare them with indicators of the nutrition situation. These results are then shared with the stakeholders who can review and comment on results before they are shared more widely and used for strategic discussions and advocacy purposes. The UN Network REACH Secretariat can assist in building visualizations that are clear and impactful. One of the most important steps in the mapping preparation is the selection and definition of core nutrition actions. The country team can leverage existing global and country resources to define selection criteria that will meet the country's priorities. Some of the considerations that should be taken into account when selecting the actions to be mapped are as follows. The key nutrition problems as identified in the country's nutrition situation analysis, if available. Country experience in nutrition-related programming to take into account cultural, logistical, and capacity considerations. Technical expertise of stakeholders from different sectors to promote a sector balance. Current data about the coverage of certain actions. Additional consideration should be data availability and whether an action can be mapped in the tool. Certain actions that do not directly reach beneficiaries, such as governance or other soft actions, cannot be mapped in the REACH tool. Other country examples of action lists can help a country formulate actions that are specific, technically mappable, and have a good balance of sectors. And a final resource is empirical evidence on the impact and effectiveness of nutrition actions, which should be considered when selecting which actions to include in the mapping exercise. Sources of this, for example, can be the Lancet 2013 and 2008 or WHO's ELENA database. Moving to the right side of the slide, you can see that these actions should be developed and validated through a participatory approach with all stakeholders. And now I'm going to take you through a demo of the tool. This demo will be on the web-based version of the tool. So in the web-based version of the tool, the first screen that you will see is the login page. For each user of the system, an individual login can be created. User profiles can be customized to allow different levels of access to the system. For example, some users will only have access to view the final results, while others will have access to also enter data for their organization. Note that user profiles can also be assigned a default language. In the setup of the system, translation of actions and other country specifics can be entered or translated into a local language, which this allows users to interact with the system in more than one language, or have multiple users who interact in a language of their choice. Today, we will log in as a stakeholder who will be entering data and also viewing results. When you first log in, you will see the dashboard page. This is something we'll discuss later when looking more closely at the results. In order to navigate the system, we will use the menu in the upper right corner to navigate through the modules. The first module we'll look at is the Sun PMT and how a stakeholder would enter data. In the data entry screen, note that the lists that you see as we move through entering data are fully customizable to the country context. This includes the list of actions, delivery mechanisms, target groups, and so on. As a reporting organization, you will start by selecting the geographic level at which data will be entered. In the demo, we use the Rwanda country structure as an example and are collecting data at the district level. In order to do this, we will select a province. This allows us to later on, as you will see, enter data at the district level. After selecting a province, or the province where we want to enter data, we will select the action. Okay, so for the action, let's say we select cash transfers to safeguard healthy diets. Next, we will select the mapping year. This is the year for which beneficiary data will be related to. So we'll pick the last complete year, so 2016. Next, we will select the delivery mechanisms. So let's say that we will select the health community as the delivery mechanism. Next, we will select the field implementer. There is a pre-customized list of field implementers available. However, if a field implementer is not already entered into the system at the beginning of the mapping process, we can type new in order to add a new stakeholder. However, let's just select ERS as our example field implementer in this demo. So once we enter our field implementer, you are given the option to provide information on other partners that are supporting the action across the different roles that we discussed earlier in the examples. As a reminder for each of the roles, you can always hover over the question mark in order to see a definition of what this role is in order to help you complete the data. The drop-down lists for each of the partner roles function in the same way as the field implementer list. You can either search for the organization of choice, or you can add a new one if necessary. Also note that if there are no partners for this particular action, then these cells can be left blank. Finally, the final part of data entry is entering the beneficiary data at the district level. So for this action, let's say that we want to enter beneficiary data for pregnant and lactating women who are receiving this action. And so we can enter our data at the district level, and once we see that that data has turned green, we know that the data has been registered in the system. Furthermore, we can also mark the action as complete. This tells us that this tells the system administrator or the technical mapping lead that the data is complete and ready for analysis. So that is all there is for data entry. The next aspect that I want to speak about or show you are the special reports that are designed for the SunPMT mapping tool. The first is a table depicting the stakeholders who are supporting each action across each of the roles. This table can be produced at the national, province, or district level. The next report is the geographic coverage per stakeholder, which provides results of the number of districts each stakeholder is reaching for each action. The final report is the population coverage per stakeholder report, which provides the population coverage of each stakeholder across each action. Each of these reports can be produced at the national or subnational levels. As an example, we will look at the geographic coverage per stakeholder report. And we will look at this at the national level. So I've selected Rwanda. Next, I will select the mapping year. In our demo, we have data in 2015. Next, I will select the reporting level. So this allows us to look at either the national level or one step down from the national level. So I will select one step down so you can see this data broken out per province. Next, I can select the stakeholder role. So I will select, for this example, the field implementers. Then I have a selection of all of the core nutrition actions that I can look at the data for. I will select just a couple to give you an example of what the table will look like. And now we can produce the table. So here you can see that for each stakeholder across the top row, we have data for each of the actions where that are being supported. So if we look at the first row, the action is animals for homestead animal rearing. And as we move across the row, we can see that Africare is reported as supporting 3 districts within the Eastern Province, or 42.86% of the districts in that province. If you move along further, the next stakeholder who has reported for this action is the Ministry of Agriculture. And we can see that they have supported 7 districts within the Eastern Province, which calculates to be 100% of districts within the Eastern Province. And as you can see, as I scroll down, there is a table for each individual province, or each of the 5 provinces in Rwanda. The next aspect of DHIS that I want to show you, beyond the special reports, are the several other types of data visualization available, all of which can be added to a dashboard, which is where we'll begin. And these dashboards can be fully customized by the country. In the demo, we have organized the dashboard by actions belonging to different thematic areas. Here, we are looking at the dashboard for actions related to food, agriculture, and healthy diets. You can see that there are several types of data visualizations available and placed on this dashboard, including an overall picture of the beneficiary coverage across all actions in this thematic area to different disaggregations of data. Each of these allows us to look at the beneficiary data reported and filtered by different features in the data. For example, in this pie chart, we can see the number of beneficiaries that are being reached through different delivery mechanisms for a particular action. Another feature of DHIS2 data visualization is that we can also manipulate these graphs and take a closer look or change them slightly in a very easy way. So we first, for example, we will look at the coverage of beneficiaries or households in this case who are receiving animals for homestead animal rearing. And here you can see that this data is disaggregated at the province level. You can see the provinces on the x-axis at the bottom of the screen. However, let's say that as a user, you are more interested in a particular province and the district coverage for that province. So, as a user, we can modify this visualization and we can look at a particular province. Let's again pick the Eastern province, and we can select districts to look at it. And then we can update our visualization and we can see the district level coverage of the same action being presented. From here, the user can save this as a new visualization in order to add it to a dashboard or to share it with other users of the system, or they can download as an image to be able to use in a presentation offline. All right, so this concludes our mapping demo. Now that you have an understanding of the mapping process, methodology, and tool, I want to speak about how these results can be used at the country level. We do not have a single prescribed use of the mapping results for a country. The use depends on the process and the objectives of each country when embarking on the mapping exercise. Through our experience supporting the mapping exercise across several countries, we have seen the mapping results have been used to support country-led processes across several aspects. One, informing prioritization of nutrition actions through looking at which actions are not being adequately covered and which actions may need more focus in order to address the nutrition challenges of a country. The results can also be used to support discussions around how to scale up actions, both in terms of how to reach more beneficiaries and how to reach a greater geographic range. Additionally, the mapping can support the development, review, or monitoring of a multisectoral nutrition plan. Finally, the mapping can help identify gaps in information systems and strengthening of these systems. Now, a couple examples. In Tanzania, the stakeholder mapping has been conducted in multiple rounds, with the most recent round taking place in 2016 and collecting data at the district level. In preparation for conducting the exercise, the stakeholders across different sectors and groups, including government and development partners, came together to determine a list of core nutrition actions to be mapped. 16 core nutrition actions were identified, defined, and cover multiple sectors, including health, agriculture, education, WASH, and social protection. And these actions are both nutrition sensitive and nutrition specific. One of the objectives of conducting the mapping exercise was to provide inputs to the annual Joint Multisectoral Nutrition Review, which is an annual event bringing together more than 200 participants from different stakeholder groups at both central and decentralized levels to discuss a broad selection of topics from the nutrition situation at the district level to the actions taking place to address key challenges and the coordination and enabling environment needed in order to scale up and improve the delivery of nutrition services. The mapping results were presented and discussed as one of the key inputs to the Multisectoral Nutrition Review. As an output, it was agreed to continue to use the REACH mapping tool in order to monitor the country's progress on these prioritized actions. My next example is in Rwanda, where the mapping exercise was conducted in 2015. The results of which were used to inform prioritization discussions around scaling up nutrition. These discussions took place through several forums. For example, The results were presented to the Technical Working Group on Nutrition in order to understand the current situation and to prepare for what to prioritize moving forward. In addition, the workshop with a larger group of non-government and government actors was conducted in order to disseminate and validate the results of the mapping. Further discussions on potential gaps in coverage and how these can be addressed were also discussed. Furthermore, the mapping data on duration of actions was analyzed to present a prospective view as to what actions would be covered in the near future. This included who and where funding is and would be in the coming years. This analysis helped donors to plan for the future when making decisions on where and what to fund in the coming years. In Burkina Faso, the mapping results were used to support the multisectoral planning process, which also included the development of the Multisectoral Nutrition Strategic Plan. It was through the exercise that it was possible to identify needs, launch a discussion on scaling up interventions, and mobilize sectors and development partners around nutrition. The mapping process and results provided a point to bring stakeholders together to discuss these key issues. And my final example is from Ghana, which was one of the first countries to conduct the mapping exercise using the REACH Excel-based tool as one of the pilots. In 2016, they conducted a second round of mapping that was conducted through the adaptation and rollout of the tool at the district level. This entailed reviewing the stakeholder mapping templates, which were used for data collection, and providing orientation sections to district nutrition officers. In the case of Ghana, the focus was to build sustainability into the mapping process by training district-level officials on the use of the tool, and thus putting in place a system to collect data on nutrition actions. While this level of mapping might make it challenging to aggregate coverage to the national level, since it was only conducted in a few districts, it allowed districts to own the data around the coverage of actions. And the overall aim was to support districts to lead the mapping process and integrate it into routine data collection systems at the district level. These 4 countries are just an example of how other countries who have conducted the mapping have used the mapping results to inform different aspects of their work at the country level. We strongly encourage each country embarking on the mapping exercise to think about and discuss the potential uses for their own mapping results as one of the first steps in the process. In conclusion of this presentation, and before we open up the floor to questions, I want to speak briefly about how to get started with the exercise and what kind of support the UN Network REACH Secretariat can provide. As just mentioned, the first steps in the process would be to meet with stakeholders at the country level, including focal points from government, UN agencies, civil society, and donors, to discuss the country-specific objectives of the mapping exercise. So thinking back on the examples that I gave and how the mapping results have been used in different countries, what does your country want the mapping to contribute to, and what is the necessary timing needed? The initial discussion should also include a discussion around which of the tools makes the most sense for your country. If DHIS2 is not already in place and technical capacity might not be present, the Excel version of the tool may be more appropriate. However, if DHIS2 is already up and running in another sector in your country and there is technical capacity available, this version of the tool might make more sense. The Secretariat can help outline the technical considerations that are important to consider when preparing for these discussions. After gaining consensus and buy-in at the country level for the exercise, you can contact the UN Network REACH Secretariat for tools, guidance material, terms of reference, and budget templates for the exercise. These materials have been developed for both the Excel and DHIS2 versions of the tool and are available in both French and English. Furthermore, the Secretariat is available to provide training on the tools and provide technical guidance throughout the mapping process. We also have helped countries connect with consultants who are trained on the tools and have experience conducting the mapping in other countries. For requests, please contact the Secretariat at unnetworkforsun@wfp.org. You can see the email address currently on your slide. Thank you for your attention, and now I would like to open up the floor to questions and also pass the mic back to Nicolas.
Thank you, Chris, for a great presentation and for running through smoothly the live demonstration that we know is always tricky. So thank you, Chris, for that. Thank you to our participants. I think there's quite a number of you that have listened through this presentation from Chris and have shared in the live box your questions. So we have about half an hour left on this webinar, and we'll try to address your questions as they came. So again, thank you so much for your questions. First question was, will participants get, not only participants, but will public get the presentation? Yes, the answer is yes. The presentation will be sent to you, and so you will have that. We had quite many questions, so let me try to organize them. Some of them organized by sender, because some people have sent several questions. So I'll try to take some of the questions, and then otherwise Chris will also have some of the questions. Maybe the first question, Chris, to you is regarding the standard definitions. Actions, are the actions standardized with definitions that explain what constitutes coverage for each one? For example, if you're looking at an action about number of ion contacts, how do the stakeholders agree on the definition, standard definition of actions?
So for the definition of actions, this is done in that first kind of workshop area where we are discussing what are the prioritized actions for a country. And at that point is where you need to get into the definition of these actions. So determining who the key stakeholders or the key target groups are for each action. And this is what's going to formulate your definition of the action. So for example, let's take an easy one. So let's say our action, our prioritized action that has been selected at the country level is the supplementation of vitamin A. So for this action, our target group that we most likely would select would be children 6 to 59 months. So with this definition, we would be able to define our action as the number of children 6 to 59 months who have received vitamin A supplementation. Vitamin A supplementation, of course, happens most likely twice a year, so we would have to consider timing in that. So we would most likely select in the last round.
Thank you, Chris. Another question came up just now on the definition, whether somebody says it would be helpful to have standardized nutrition action defined ahead of time like they did for the HIV interventions. So just to share with the participants that we, with the UN Network for Sun, together with the colleagues with the UN agencies, have developed the Compendium of Action for Nutrition, which brings together all the nutrition intervention that have evidence behind it. So we document in one place standardized nutrition actions and the evidence attached to those ones. So the tool could be, the actions could, the can could really help in bringing and getting that consensus discussion around that core nutrition action that needs to be mapped. So there are some standardized definitions already available, and it's very much part of the first step in the process, which is getting consensus about the actions that need to be mapped, what are the criteria for inclusion of actions to be mapped, and the clear definitions, so everybody participating in the mapping has the same understanding. Another question we received is why 75% used for the threshold and not 90%, which is the Lancet percentage coverage proven to reduce stunting. So the 75% was very much used as a first cutoff there. And then obviously the data can be reanalyzed against the 90% Lancet percentage coverage, but as a first cut, we've used 75%. But as the data is collected and exists, they can certainly rerun the analysis of the data against the 90%. Chris, do you want to add anything to that?
Yes, and specifically for that cutoff, that was a country-defined cutoff that was chosen for the analysis. And the tool is flexible enough for you to decide on which cutoffs are appropriate based on your data and the country context.
Thanks, Chris. A related question that also came up was just wondering if population coverage ever ends up more than 100%. And for example, in the case if there's multiple partners co-funding a program and reporting same beneficiaries. And I would add to that, what do we do in this case, Chris?
So this is an excellent question and maybe one of my favorite ones to answer. So for in the tool, when we find coverage over 100%, I'll talk about this, how we address this among both of the tools. So, because it can come up in either, but we can address it in different ways based on the tool. In the Excel tool, we use the automated reporting tables to identify where coverage is over 100%. And then it's a matter of looking back at the data that has been entered in order to look across the partners who have reported, across the beneficiaries and geographic areas reported to find where that duplication is. And of course, this is a hand cleaning process done within your Excel database. In the web-based tool, when there is data reported at the same geographic location for the same target groups, for the same action with the same field implementer, then the tool automatically gives you a warning that there's already been data entered here. And so then you're able to address that potential duplication of action before even entering it into the tool. So there's two kind of ways. In our Excel base, it's something that a cleaning process that we address throughout as we start to look at the results, primarily looking at those different stakeholder roles that we use. So that helps us to identify where there could potentially be this duplication. And then on the web-based side, the system helps us to identify before entering the data where there's already been data entered for this action at this level with the same field implementer.
Thank you, Chris. And that takes care of the other question that came about double counting a unique identifier. So obviously there's no unique identifiers, but it's very much a facilitated process. So as a first step, we know who are the partners working on the same activity in the same area, and we can start a dialogue to really understand whether they're reaching the same beneficiary, the same villages, the same households, and really look into more in depth as Chris explained. And there was another question on one question. There's several questions. So one question is the challenge here when this is a one-off exercise and not continuously updated, and how will we encourage updating and integration into the country systems? And so yes, it is for most of the countries. I would not say one-off exercise. It's a first time they're going to be actually coming together to really get a sense of coverage data out of routine program data. And so most of the countries, I gave you the number, there's quite a bit of them that have gone through the exercise. Some of them are in the process of doing it, but it's going to be it's first time very much where we bring sectors together, we bring ministries together, we bring UN, we bring society organizations, donors around the same table to discuss coverage and from existing routine data. And so now we are seeing countries that are looking into the second round of the mapping. They have done a mapping. Most of them, the ones that are asking for a second run, a year or 2 years ago, and then they want to update the data. So we are now in discussion with several countries about rerunning the data. The important point, because it is a process, because it's country-owned, capacity already exists in the country to run the exercise. And we're seeing it's easier for the countries to look and consider a second exercise because they've already done it. Now, the second advantage we have is that it's now available on a web-based platform. So obviously, the countries that are doing on a web base, it's much easier for them to then update the data in the same database and even consider more regular data. Now, at the moment, what was presented by Chris, we're looking at annual data, but obviously, as most of the partners countries work on annual data, 6 monthly, more regular, then that if the process exists in place in country, then obviously the data could be fed into the web-based platform on a more regular basis. The third point about integration into the country system is also the fact that it is on the DHIS2 platform. There's a reason why we decided to build it on that platform, because there's a lot of capacity that exists at country on the DHIS2, mostly in the health sector, because a lot of the countries, low-income countries, middle-income countries, have chosen the DHIS2 to be the base platform for their health information system. And so there's a lot of capacity there, and opportunity to then make those systems speak to one another and then integrate better system-wise with the system. I hope that answered that very, very important question. There was a next question on support cost to countries. I'm trying to find a question with availability to non-SAM countries and overall cost and things like this. So basically, the way Christine explains the process is it is a facilitated process. It is a country-owned process. So it's very important that it is led by the government. And in some countries, it is the central government being the key person in that process. It is important that it is a country-owned. So, like Chris presented, we're looking at a technical lead to be very much the lead on the technical mapping. Ideally, this person should be from the government, somebody already on payroll in the government who would be made available to the period of time which we're looking at, around 3 months' time to conduct the exercise. So to have a dedicated person already from government, from one of the key ministries, from Office of Statistics, from planning, who would be then made available to be the technical lead. And so then there's no additional cost attached to that because the person is already from the government. The second option is to look at national consultants. And we've worked in many countries by identifying very good caliber national consultants to support the process. Last options that last resort I would say is to go with international consultants, but it's not the preferred option. So really, skills, capacities exist already in country, either already through in-country staff or someone or a national consultant. Another question is where is the data hosted given that the country is trying to take this tool up? Is it possible to link with the local government server? What is the cost implication? It's a good question. What Chris presented to you is the demo. That demo sits on WFP server just as the demo. Now, a country that wants to run with the web-based tool will need to host the web base, the server, and the database. So it's important that it is sitting on a government, local government, or at country level on a server, and it's owned by the country and by the government. So there are some cost implications to that, although maintenance of the database in the level that we have remains very manageable. The other thing is, again, because it is a DHIS2 platform, it could be in countries that would want to have that option, it could be part of an instance of the already existing DHIS2 environment in the country. And in that case, there may not be any cost implications. So by doing it, by developing it under the DHIS2 platform, we also look at the opportunity to piggyback on already the DHIS2 environment in the country. So minimizing the cost in the process. I'm looking at another question. The consultations and workshops described are important. Will Richardson develop a facilitator's guide for these meetings to make sure the key points are adequately covered? Chris?
So within the training guidance and package coming for both of these tools, we do have guidance around how to facilitate these workshops. And so again, we provide example agendas and talking points and how to develop, the core nutrition actions and to come to consensus around the mapping component. And of course, we do encourage and appreciate customization at the country level in terms of bringing up priority needs. And so there's flexibility, and we encourage countries to also think about how to add and to build on that agenda, example agenda points that we can provide and help you to put together.
Thank you, Chris. Another question that came to us is regarding what do we do with the mappings? What is the expense of countries? The question was, yes, how will actions on the mapping results also be promoted? So for example, if breastfeeding promotion is localized to a particular region, what steps will be taken to expand the actions and how will it be promoted and encouraged by the organizations? Good question. It is a process. So the mapping is very much part of a broader process of scaling up very essential interventions that have been agreed by the country. And so the first thing to do is really get a consensus among all the partners about what the issues are, where are the maybe the particular geographical areas, the particular target groups, the particular intervention that may not be put at scale, or for which there's not partners to be put at scale, and they may not be the response may not be matching the situation. And so, because it is a process, the mapping team that's there are from the multi-stakeholders groups. What we've seen in the countries, and we have participation from everyone, including from governments, from UN, civil society, and donors, and they are part of the also analysis of the data and the interpretation of the data. So at the end of that exercise, there's very much a consensus about not only what is the situations, but what are the priority and what do we want to do to address these issues. And because the government is in the lead, there is an opportunity to really take concrete actions on that and influencing basically the next steps in the planning process, the choice of interventions, the choice of areas where interventions should be prioritized. There are some countries where, for example, after the mapping, the Nutrition Secretariat were directly contacted by donors to say, what is the situation in a particular area? I want to know from your mapping, so what intervention should I be supporting and in which area and through which mechanisms, because mapping, as Chris presented, also gives us information about the delivery mechanisms. Any more questions? There's a question on global level planning. That's a good question. The mapping very much at the moment, the way Chris described, is a country level mapping. The objective of that is very much to get the data on the table, to get consensus from the partners so they can really influence a better planning process. We have not done expanding that to the global level. There are other mechanisms that Chris presented in the first slide about the global level mapping, which are very important exercise also. But at the same time, once we start to generate a lot of data from the tool that we've presented to you and country present the data, then there will be an opportunity, as we are coming up with reasonably standard way of mapping and understanding geographical coverage and population coverage, so we can start to have a bit of a global overview of the situation. And that's very much the discussion we're having with the Sun Movement Secretariat, who see very much mapping as a clear foundation of the monitoring and evaluation framework, in that by bringing countries on mapping, having discussions, making sure we start to get some standardization around that, then we can start to look at countries that achieve a certain level and compare data coming out of the mapping, compare country data from data coming out of the mapping exercise. And then which countries have done the exercise in Asia. And so we have done the exercise. Earlier version of the mapping exercise was done in Bangladesh and Nepal. And a more recent exercise was done in Lao PDR, and a very recent exercise was done in Myanmar. Now we are in discussion, for example, in Lao, to have a second iteration of that exercise. But basically, that's what it is at the moment in the Asia region. Any further questions, colleagues, that we have not addressed? There's a question on, and I'll address that to Chris. Is there a way to determine that all organizations have entered their most recent information or data? What to get that all organizations?
All right. So I'm going to just start by saying that, of course, this is one of the challenges with the mapping, in that the data and the analysis are really only as good as the data that we put into the exercise. So that being said, we take a multi-pronged approach in terms of making sure that we're collecting, or at least trying to attempt to collect data from all relevant organizations. And so we often, in country, we work with civil society alliances and their membership lists, development groups, or development partner groups, and other structures at the country level where stakeholders are coming together around nutrition. So we use that as our starting point for the mapping exercise, and in terms of reaching out to partners outside the government. And then, of course, we also reach out to government colleagues across multiple sectors related to where the different actions are owned. So, of course, this begins to get at least the higher level or central level players within nutrition at a country level. Through this, we are also able to identify additional partners who are working with some of these actors. For example, through WFP, we are able to reach their field implementers through the WFP country office as a way of identifying further actors within nutrition.
Thanks, Chris. We have time for a couple more questions. So there was a follow-up questions from one of you regarding the use of CAN and the action. So the CAN is not preloaded into the tool, but it serves as a basis for discussion with all the partners to identify the interventions to be mapped. So what we have seen so far is that countries undertaking mapping map about 25 to 30 interventions, and from all the different sectors and health sectors, agricultural sectors, social protection, and wash and care. So very much a multi-sectoral approach, but a list of about 25 to 30 actions. Some countries that are starting the process are also looking at using the tool to map more comprehensively, their nutrition plans, and so that would go obviously beyond the 25 to 30 list, and we are working with them on making that happen and making sure the tool is adapted for mapping the broader nutrition plan. There's another question regarding what incentives or benefit is there for implementing agencies to provide information. So what we have seen so far is that because it is a country-led process, in some countries, the Sun focal point plays a key role. And in some countries where, for example, the civil society networks is well organized as an alliance, what we've seen is that there is very much keen interest from implementation agencies to be part of that, because it is a process that is country-led and country-driven. And so obviously, one of the areas we're looking at is by working through the civil society network at country level, the mapping team, the technical lead, really already gets a first list of the organization and implementation partners that are likely to be working on those activities. That gives a first cut of the list, but then it's being refined through the different one-on-one processes and also the different discussion and the workshop. So we've seen, for example, agencies that were not included, or implementing agencies that were not included in the first list of agencies that says we want to be there. So there's kind of quite a momentum when the mapping starts for partners to all be involved in that process. So we're very happy. And obviously, like I said, to work with our civil society network as part of the Sun network really helps in them managing and coordinating the participation of the implementing agencies to that process. So maybe one last question. Other situations such as agriculture for nutrition actions. You want to take that one, Chris?
Yes, thank you. So this is a great question. The tool itself relies on the very basic principle of these actions that are mappable. So if you have actions that can have a defined beneficiary or target group, then those actions can be mapped. So it is not restricted to a sector. In fact, since we are working, or since we use this tool in nutrition, we are often working with actions coming from multiple sectors. So there are not restrictions to the sectors that this could work in. So it very much could be used within the agricultural context.
Thank you, Chris. Just one last question on the validation of the tool. So the tool is just a way of collecting the data that is very similar to DXL, but in a web-based platform. So that validation of the content of the tool, of what it produced, the analysis, the visual, what comes out of that is very much validated at country level. So countries are the ones validating the content. And only when it's validated are we allowed to then, us at the Secretary, to share that more broadly. And so what has been presented to you today, naming countries, showing examples, is already a validated process. The tool is just there to support the ore collection and the mapping process. I will stop here and back to Aaron, just reminding you that you will get the presentation. And for any questions you may have regarding the tool at global, regional, country level, we're available, and the contact is the UN Network for Sun at WFP.org. Over to Aaron for closure.
Great. Thank you again so much, everyone, for attending. As Nicolas noted, we'll have the recording and the slides to you for anyone who registered or attended, and those will arrive in your inbox Thank you again. Again, if you have colleagues who prefer to speak in French, we'll be doing this exact same session in about half an hour, all in French. So look forward to continuing to work with you all, and have a lovely rest of your day or your evening. Take care.